When you open the FirstFit workbox, you will find all the tools you need to perform the case efficiently, predictably, and quickly while obtaining the desired result. Each case will include the customized preparation and cementation guides and a model of the case. You will also have the burrs for each set of guides, the veneers, and the night guard. You will need to prepare the materials for the cementation of the veneers. Step by step, using the FirstFit system. Handpiece test. Check that the handpiece and coupler work in your unit. We recommend performing these checks prior to the day of cementation in case your chair requires a different coupler. If a different coupler is required, contact our team to make the change. Check that the adjustment of the guides is correct. First, place the objurgate followed by the first guide, and then, with the help of the mirror, from the occlusal region of the last piece that the guide reaches, check that it's well adjusted. In addition, look through the windows of the boxes to ensure the guide fits correctly. Once you have checked the fit, the guides should be placed in order following the numbering shown on the side. The guides will include a letter marking indicating the burr to be used on each guide. The color will indicate the grain of the burr. For example, if we have A and C guides, this would be the ideal way to arrange them. In one row, place the guides with the letter A, and in another row, place the guides with the letter C. To facilitate the movement of the disc, we suggest you apply oil-free glycerin gel on the rails. For example, liquid strip Ivoclar. Before beginning, check that the burr is correctly inserted in the handpiece. If the burr is not fully inserted, it will not fit inside the guide or could rub against the entry rail. With the objurgate in place and our number 1 guide in the mouth, gradually slide the handpiece from one side to the other until you find no resistance in the handpiece from mesial to distal within the prep box. Never use force. It's necessary to look for the position in the handpiece in which it slides smoothly. At this point, exert a little more pressure on the burr towards the tooth to finish the preparation. Once you consider you have completed the preparation, we suggest you turn off the water and perform the preparation movement again for 10 seconds, sliding the handpiece from mesial to distal of the guide while making sure that no enamel powder is generated. To complete the prep check, slide the handpiece without activating the pedal and check that the burr does not rotate. If it rotates, it would mean that there is still some friction and you should continue to prep that area. The recommended work position is at 12 o'clock, always trying to work parallel to the tooth you are preparing. To facilitate the procedure, ask your patient to change the position of their head. Gently insert the disc inside the guide to avoid lever movements that could fracture the entry flaps. Please do not forget to change the burr when the guide indicates it. This will ensure preparations are performed accurately. Once the preparations with the guides have been completed, we will take a red Solflex disc and remove the aprismatic enamel from the areas of the tooth that have not been touched by the guides. In addition, we will round off sharp internal edges that may cause a fracture in the veneer. The objective of this step is to polish the surface of the tooth for the subsequent try-in and placement of the veneers. In some cases, it may be necessary to open points of contact using 0.1 mm polishing strips. Step-by-step of the try-in. The guide where the veneers are positioned is semi-flexible, so it can be manipulated. Do so gently and never force a movement since the veneers could fall off. The veneers are tried on using Variolink Aesthetic try-in water-soluble glycerin paste. When positioning the cementation guide in the mouth, use the midline as reference with an insertion axis of 45 degrees with respect to the teeth. Verify that the fit of the veneers at the cervical level is correct. The Variolink Aesthetic try-in pastes simulate the chromatic effect of the ceramic restorations that will subsequently be cemented using Variolink Aesthetic LC composite. The shade and translucency of the try-in pastes correspond to those of the cured Variolink Aesthetic LC composite. Once we have verified the correct fit of the veneers at the cervical level and selected the shade of our cement, we will proceed to prep the veneers and the teeth. Step by step. Preparation of the veneers. In the following protocol, we will examine the placement of IPS Emax lithium disilicate veneers cemented with Variolink Aesthetic LC by Ivoclar Vivident. If you wish to use a different material, please let us know and our team will indicate the necessary adjustments. Step 1. Clean the Variolink veneer try-in paste with plenty of water until the veneer surface is clean. We recommend cleaning it again using a microbrush and alcohol. Rinse once more and dry very well using air. Step 2. The etching is carried out with 5% hydrofluoric acid. Leave it on for 20 seconds on each veneer. Subsequently, rinse the veneer with plenty of water and dry. We recommend cleaning it using isopropyl alcohol in ultrasound for 4 minutes. In case you do not have this equipment, you can clean it with 37% orthophosphoric acid and a microbrush. Wash with abundant water and dry completely. Step 3. Apply saline on the surface of the pre-treated veneer and leave it on for at least 60 seconds. Once completed, the veneers will be ready to be cemented. Step-by-step preparation of the teeth. Step 1. Isolate the treatment area using a rubber dam or similar forms of isolators. For example, Optrogate. Air dry the area. Step 2. Clean the teeth where veneers will be placed with a polishing brush and an acetate and fluoride-free paste. For example, fluoride-free peroxide. Then, clean with water and air dry. Step 3. Apply 37% total etch, or orthophosphoric acid gel, on tooth enamel for 15 to 30 seconds. Then, rinse the gel thoroughly with a powerful water jet for at least 5 seconds and dry the tooth surface thoroughly until the etched enamel surface has a chalky white appearance. Step 4. Apply Ivoclar Vivident Universal Adhesive. Start with the enamel and generously cover the surface of the teeth to be treated. Run the adhesive on the tooth surface for at least 20 seconds. Don't leave it on for less than the indicated time. Disperse the universal adhesive with oil-free compressed air until a moving, shiny, liquid-free layer is achieved. Important: do not create puddles, as this may affect the fit of the restoration. Light cure the adhesive for 10 seconds. This will prepare the tooth surface. Step-by-step of the cementation. Step 1. Place Variolink Aesthetic LC using the application tip directly onto the inner surface of the veneers. Start from the incisal using S-shaped movements up to cervical. When applying the cement on the veneers, it is preferable to overdo it rather than underdo it, as the excess material can be easily removed. You will be using a color-stable adhesive cementation system for the permanent cementation of the ceramic restorations. Variolink Aesthetic is available in a purely photopolymerizable version. Always use Variolink Aesthetic LC to cement FirstFit veneers. Shades. Variolink Aesthetic LC is available in the following shades. Variolink Aesthetic shades are based on the effect that the cementation composite has on the tone of the final restoration. Variolink Aesthetic Neutral does not affect the tone of the restoration and is the most translucent shade. The Light and Light Plus shades achieve a brighter restoration, while Warm and Warm Plus are less bright. To evaluate the full effect of the restoration in conjunction with the different Variolink Aesthetic shades prior to the permanent cementation, use the Variolink Aesthetic Try-On pastes. Step 3. Once the initial excess cement has been removed, fix the veneer in place, exerting pressure on the center with your finger from the veneer towards the tooth. Step 4. The suggested times mentioned in this protocol are based on the Blue Phase style lamp using 2 different types of tips. First, place the Light Pro pinpoint tip in the center of the veneer. This tip has a diameter of 2 mm, so it's smaller than the usual tip and allows to focus the light point on a specific area of the veneer without proximal and gingival polymers. Apply light with the pinpoint tip for 5 seconds for each veneer. Then, remove the excess cement in the proximal, cervical, and palatal areas, because when you exert this pressure, it is normal for some material to overflow. Don't worry, the cement is still in gel phase and can be easily removed using a brush. Step 5. Change the pinpoint tip to a regular size tip. Give a very fast flash of light from mesial to distal of the veneers, as you can see in the video. Step 6. With the help of a curette, remove the cementation guide. Start from posterior and generate a slight lever movement to remove the guide. Step 7. Once the cementation guide is removed, clean the proximal, cervical, and palatal areas using a brush and carefully pass the dental saw through all the teeth, making sure not to traumatize the gums to avoid bleeding and possible filtrations. For this reason, we recommend that the assistant is nearby with the photocuring lamp so that if there is any bleeding, they can completely photocure immediately. Next, pass dental floss between all teeth. Step 8. Apply glycerin gel, for example liquid strip. Like all composite systems, Variolink Aesthetic is subject to oxygen inhibition. This means that the surface layer, approximately 50 micron, will not polymerize during the light curing phase as it has been in contact with atmospheric oxygen. To prevent this, cover the margins of the restoration with a glycerin gel immediately after removing the excess. Step 9. Remove the final polymerization with the blue face style lamp for 20 seconds per vestibular and 20 seconds per palatal on each veneer. Step 10. Remove the glycerin gel with plenty of water. Step by step of the final adjustment. Step 1. Check the occlusion and make adjustments if necessary. Step 2. Go over the cervical margins with yellow-rimmed diamond burrs or a scalpel with a number 12 blade if necessary. Step 3. Polish the restoration with the appropriate ceramic instruments, for example, Optifind. Step 4. Give your patient their personalized night guard that will always be included in your cases and explain the importance of wearing it every night. Keep in mind that if the patient suffers from any type of parafunction, a different type of guard will be necessary. This may include a Michigan guard or whatever you deem necessary to ensure the veneers are secure.